Hi guys, welcome to Sexual and Reproductive Health Corner with Dr. Ifnaya Lillian. If you are new here, I raise awareness on issues concerning women and children. Today we'll be talking about a peculiar issue. This issue is going to concern women that have boys at home. When you have a male child, by the time the child is around a year, 7 months or getting to 2 years, you will notice that the child is always touching his penis. Yeah. And this can be a concern to you because due to our cultural orientation while growing up, some of us haven't experienced such a thing, and to us, with our adult mindset and cultural orientation, it's something that actually looks like a taboo to us, and we tend to even beat this child or shout on the child to stop touching their penis. So this video is going to address this issue and tell you possible things that can cause it and how you can get your child to stop doing that. So please stay with me. Right, so first of all, you need to understand that for a child that is almost 2 years or 2-year-old to around 5 to 6 years, it is normal for them to touch their penis, their scrotum, feel their balls, and at the point of doing that, they will also notice that there is this sweet sensation that comes from touching their penis, so they will keep doing it. So this is normal. It is not an abnormality, it is not a taboo, it is them realizing that there is something on their body. What's this long thing on my body? And they just want to feel it, and it is a normal thing for boys. I know you are worried. What if he continues doing that and he does that outside when you guys go out in public? I know how worried you are about this act and how you want your child to stop it, because children, they don't know anything and they can even do this in public, and it is something you are actually worried about, even though I've already said that most times it's a natural occurring thing. Okay, so before we go into the things that can help you to distract your child from doing that or to stop it completely, let me mention that apart from it being a natural occurrence, there are some conditions that can actually make your child to be more frequent with touching his or his penis, and these things can be a health concern. So if you notice that your child has started touching his penis, and the first thing you need to understand is that it is normal first. Then another thing you need to do is to examine the penis. Bring your child close, expose the child and examine the penis. Is there rashes around the penile area, the penis, the scrotum? Raise the scrotum up, check if there is rashes there, reddish or just normal rashes there, and note it. Check if there is the mark of the baby's finger there while he's scratching, because to touch the penis is different from scratching it. If your baby is scratching, it means that there is something else that is happening, and if there is rashes there, obviously something else is going on. Also note if there are other changes around the penis, or if there is anything coming out from the penis. This could be a sign of urinary tract infection, which is common in that age. So, and also observe if your child is having fever during this period. This is where you need to take your child to the hospital to see a doctor. They're going to examine the child and run some tests for the child to know if the child has urinary tract infection, and it will get treated. Alright, so if you want to stop your child from touching his penis because it looks embarrassing to you, the first thing you should know is that you don't shout at the child. Please don't shout at the child, because if you beat the child or shout at the child, it's going to put fear in the child. It's going to make tamper with the child's self-esteem, and the child will start having this feeling of there's something wrong. You know, the child will start having that guilt, unnecessary guilt that is not supposed to feel at that age. So don't shout at the child, don't beat the child. So the things you can do is this: if you notice your child is touching the penis, just call the child by name. When you call the child by name, it's going to draw his or her attention to you. So you can send the child on errand like, get this water bottle for me, bring your plate for me, come and take this, close the door for me. And you know, children, they have short attention span. So once you distract them, they are going to leave their penis and they are going to focus on what you ask them to do. And once you distract them, that is it for that period. Another thing you can do is that, because it's a child that is under 5 years and is still in nursery school, you can start reciting nursery rhymes for the baby, like my head, my shoulder, my knee, my toe. Such things will make the baby to start using his hand to do other things, and then let the penis be. Okay, so these are the things that you can do to distract the child, and also be patient with the child. By the time the child gets to 5 years, 6 years, it's going to start having that self-awareness and it's going to stop it gradually. Okay, other things you can do to also minimize the frequency of your child touching penis is to make sure that the diaper the baby is wearing is not too tight, because if the diaper is too tight, it's going to be rubbing on the penis and be causing friction there. So, and that irritability can make your child to touch the penis to suit it. And that you need to do is to moisturize the baby area before putting on pampers to avoid rashes or things that can lead to irritation. So a baby doesn't have to go and touch the penis to suit it. So in summary, I want you to understand that for babies between the age of 2 and 5 year or 6 year old, touching their penis is normal to them, because it is them just realizing that what's this on my body, and by the time they are doing that, they also observe that there is this sweet feeling they're having, and they will keep doing it. So you have to distract them with activities or through music. So engage them in other things to take their mind away from what they are currently doing. And you also need to observe your baby's penile area to know if there's rashes, redness, or any changes occurring there, or if baby is having fever during this period, to take baby to the hospital to be evaluated and make sure baby doesn't have urinary tract infection. If your baby has urinary tract infection, it's no cause for alarm. It's going to be treated and your baby is going to be fine. I hope this helps you to be a super mom to a baby boy. Thank you, and thanks for watching. Share this video with your friends to enlighten them too. Bye.